TV13 have become very good friends. Yeah. Keep in contact. By
Yeah.
So.
Yeah.
Okay, well, I promise this will be as painless as possible for you. I guess I wanted to start with just asking you to talk a little bit about your experience treating patients prior to the construction of the Comprehensive Breast Center, what that looked like, what that felt like, and what's different now, especially a year after its opening.
Yeah. I think if I was going to provide one word to summarize what the experience was like before, it was institutional. Coming to a hospital facility for what is it, in effect, an outpatient procedure is an uncomfortable place to be already, and watching the major paradigm shift from walking into an institution as opposed to walking into a very comfortable, warm environment that we provide here at the Breast Center. It's been probably the biggest shift. You don't feel the same. You just immediately have this sense of calm, and you realize that there are people around you who do nothing but take care of patients who are experiencing exactly what you're experiencing every day. And whether you're only here for a diagnostic mammogram to work up something, whether you're here just for your screening study and you have no history of breast cancer and you don't expect there to be anything wrong, or if you're the person who knows you're here for that biopsy, regardless of the scenario, you're comforted by what it is that you experience here, from the first person you are greeted by at the door all the way to the time that you may spend in the procedure room. Our nursing staff is excellent. Our technologists are excellent. They all know exactly what it means to be in a patient's shoes, and we do everything we can to make our patients comfortable and convey to them that they should be confident that they're being treated by a team of people, physicians, technologists, nursing staff, who are providing them the highest level of care.
I love when I ask one question and the answer's 4.
Mm-hmm.
It's just
really
fantastic.
nice.
Oh, I
know. Good insight.
Is it difficult to talk about the benefits of a comprehensive breast center and a breast health program without the fear of using the C word? Is this, how much of your daily activities do you get to talk about breast health without having to talk about the worry that sometimes that brings?
So I'll look at this from a age spectrum, because we see young ladies here who are in their teens all the way up to women who are in their 80s and 90s. So it's not uncommon for me to have the opportunity to speak to a very wide age range. Some of the most rewarding times I have here are actually working with some of the younger women who aren't even of the age where they would normally have screening mammograms, but who have presented with something, usually a palpable abnormality in their breast. And it's because I get the chance to educate. There's nothing like being able to walk into a room with a young girl, maybe she's 18 or 19, who has had no experience really in understanding what it means to start to think about breast health, and then to have that opportunity to walk in the room and to tell her, listen, what you're feeling is normal. In some cases, in other cases, you do have a finding, but it's not a finding that we're worried about. But then I can get them started, early on, if I can set the hook, so to speak, and get them to realize, okay, this is a real issue here. I am a young person, but I need to begin to be responsible for my own health, and I need to begin by, doing X, Y, and Z, doing certain things just to make sure that I'm doing the right thing to take care of myself. So, that's a really good experience. Every time I'm in the room with a woman 40 years or older, or someone who maybe has a family history of breast cancer, who's here getting screening at an earlier age, there's almost never a time where I don't say the C word. I say cancer routinely. because I don't want there to be stigma about it. The fact of the matter is, our team's here every single day to try to diagnose that cancer before it changes your life. It's going to change your life no matter what if you get the diagnosis, but we're trying to find disease early so that we minimize the impact that it has on your life. I don't look at that word as a scary word or something that I shouldn't say. I find in my experience that people do very well when you're honest with them, when you tell them exactly what you think, and you paint a real picture. And if someone has the power and the knowledge of knowing what it is that they have, it's that much more power that they have to win the battle against it. So that's been my experience.
So you talked about power and knowledge. This is a question that came up at a recent community event where we had an information table for breast health. We talk a lot about regular self-breast exams and finding lumps, looking for lumps. From your perspective, what is it that a lump feels like in a breast exam? What is it that a woman should be looking for?
Yeah. I mean, there are a lot of different words that have been used to describe them, and usually we use things that we're accustomed to touching, right? I mean, sometimes a lump may be a BB, it may be a pea, sometimes it may be a grape, sometimes it's a walnut. There are a lot of things, usually foods or small articles that we'll describe. It really depends a lot on the size of the woman's breast, to be honest with you, because in someone who has a smaller breast size, a lump is going to be more obvious, and generally it's something that has more of a chance of being noticeable, not only by her, but by anyone else doing a breast exam. When you start to get into a larger breasted woman who maybe has a lot of dense tissue, then it's the equivalent of the polar bear in the snowstorm scenario, where it can be very extremely difficult to know what it is that you're feeling. But in general, in our experience, most suspicious lumps are firm and fixed.
So I imagine that knowing you're normal becomes very important.
Knowing you're normal is key. In fact, part of the education that I do, which I told you sometimes begins with women who aren't even yet of age for screening mammography, but all the way through, and in particular in the women who are dense-breasted. And I love it when a technologist comes in and tells me this woman does not do her own breast exams, because for me that's an opportunity. I walk in and I just take the moment to say, I know it's hard. I know it's difficult to know what your normal is, but you're the only person who has the chance every day of the week to know it. So we ask you to try to learn as best as you can by doing a comprehensive exam, what is your normal? And when there's something that's not normal to you, that's an indication for you to get in touch with your physician and have them do a clinical breast exam. If the clinical breast exam is at all concerning to your physician, we'll see you and we'll resolve it.
Can you talk to me a little bit about the Risk Plus, the high-risk program here at the Comprehensive Breast Center?
Yeah, the risk program here has really exploded. It took a little while, just like everything new, but there's no question that the impact that risk stratification has on unsuspected women who actually have a knowledge of a family history of breast cancer, but not really how deeply it penetrated, all the way up to the women who know that they have a family member who carries a gene mutation. This program is now in full force, and it has, again, changed the paradigm of the way breast services were provided in this community. Certainly there were physicians that were doing risk stratification on their own now, but I don't believe anybody was doing it to the comprehensive level that we are. And as my role in the center as Comprehensive Breast Center Medical Director, but also as I oversee our physician assistant, Kelly Jensen, who is in charge of our high-risk program, I'm also evaluating the patient cases that she sees. And I realize, in fact, interesting that you would ask me this just today, there were 2 patients who came through who have a known family history for gene mutations, and they both tested positive themselves for the gene mutations. So, some people may look at it and say, well, that's only a couple people. I mean, yeah, it's only a couple people. It's a couple people that could be your mom, your sister, your daughter, anybody. So, again, it's all about knowledge. The knowledge of where you stand. Are you at increased risk or aren't you? Do you or don't you require additional screening? Should we or shouldn't we be doing MRI? maybe you should consider prophylactic mastectomy in rare instances, depending on what the scenario is. Maybe you would benefit from hormone therapy. There are so many things that our risk program turns the light switch on. You might need to begin screening with pelvic ultrasound to evaluate your ovaries on a regular basis. So, all these things that you wouldn't have otherwise considered as really minimally invasive things that could be done, most of them, to try to establish whether or not you do or don't have something to worry about. And worrying is the worst. That's what everybody does. They sit there and they worry about it, and worry creates inaction, and we're not here for inaction. We're not here to react. Okay, we're here to be proactive and go out into the community and to take care of the women in the community. We don't want them to react. We want to actually proact.
It's ironic that you mentioned the word worry. I had the opportunity to interview Holly last week and her husband, Optum, and they both said one of the most beneficial aspects of their treatment through Mercy Health was that they didn't have to worry about the treatment. They could just focus on what it was doing internally to their family because of the great care they were receiving. So when you hear comments like that, what does that do to you? What impact does that have on you personally and professionally when you hear that?
It makes me realize how lucky we are to be surrounded by the hardworking people who make up the heart and soul of this breast center. And nurse navigation has revolutionized in as much as anything that the team of radiologists may have done, the dedicated efforts of the surgery staff, the oncology staff, the hard work that the pathologists have done. There's no question that nurse navigation has done equally as much to revolutionize the way that services are provided here. Our nurse navigator, Mary Miller, is one of the hardest working people I know. She's compassionate, she's dedicated, she's someone to smile with, a shoulder to cry on. She's all those things to each one of these patients on a regular basis. And I would imagine that if you took a poll and asked a large percentage of our patients, what they will remember the most of the experience, Mary's name's going to be in there. Nurse navigation is huge in making this program work, and it's probably one of the most important things that we have done here as an organization to make sure that there are no loose ends, that it's a streamless continuum for our patients to go from diagnosis to therapy to sometimes definitive therapy even after that, and then ultimately to survivorship. And Mary follows them from beginning to end. So it's a very big deal, and I think that's probably the most important thing to me.
That's great. You talk a lot about the team here. I also know, depending on a diagnosis and a treatment plan, the larger team at the Johnson Family Cancer Center also serves several of the patients that come through the CVC. Can you talk to me a little bit about that relationship and kind of how that's looked and how it maybe even changed since last year when this opened?
We always have had breast tumor boards, and so breast tumor board was an opportunity for surgery, oncology, pathology, radiology, everyone to come together. Funny how a name can change things, because we went from breast tumor board to what is actually now considered a tumor-specific breast conference. Another name for it is the, oh boy, I just started blanking. What do we call it? Not the of course on camera I'm having a blank right now. It's the, it is funny how things are all about a name, because I just lost it. The breast, it's not, Mary would know.
You can come back.
Yeah, I'll come back to it. But my point is that in making the name change from calling this tumor board to making it more of a breast specific subspecialty conference. And more or less going through the NAPBC accreditation, everyone that participates is a little bit more involved than they used to be. Everybody has, I think, grown to appreciate a greater understanding of what it means to be working together as a team. And that's what the goal of this was. You know, the goal of this was to improve quality and improve timeliness and efficiency. And there's no question that quality has improved. We're measured over 30+ metrics on a monthly basis through our affiliation with the Mercy Cancer Network, and so we know where we're going with quality. We know we're meeting and or exceeding our quality markers on a routine basis and getting commended for that, and we are thrilled. And then timeliness happens to be one of the things that's being measured, so we know where we started, we know where we want to be, and we continue to work on timeliness and efficiency for the good of the patient, and really for the good of the institution. We want patients to know that we can provide them a service in a very efficient manner, and that in that efficiency they're still getting the same high quality care that they should expect from a center such as ours. So I think that's probably most of it.
Triple Crown accreditation, what does that mean?
Well, you probably don't want this one on the camera, but I think it means you guys aren't publishing that enough. Why don't I see that on a billboard? Where do I see it? I don't see it.
Talk about that at 3:50.
Okay, we'll get to that. Okay, so back on. No, I mean, not everybody gets to participate in a longitudinal goal, such as the evolution of a comprehensive breast center with 3 separate national accreditations. It has been a very challenging experience and a rewarding experience, and a experience that proves that you can do anything you want to do if you work hard enough. And that credit, goes to every single person that had their hands on this project. It certainly does not go to me. I have had the pleasure and sometimes I hate to use this word, but it almost feels like I have been blessed and it has been a reverent experience, because there are so many people who feel so strongly and so compassionately about this, and who laid down their time, compensated or not, didn't matter, to reach the goal, and continuously every day still doing it over and over again, putting in that extra something to make sure that we're meeting and exceeding everything that we promised to the community of patients, to the administration, to ourselves, and to the donors. It's very important. We had a vision, and people shared in that, and we owe it to them to produce what it is that we said we would produce, and I'm confident that we've done that. And my eyes are set on reaccreditation.
Already?
Always.
Good.
Yeah.
It's obvious how grateful you are to the staff and everything they do to provide wonderful care to the patients. What is your message to the donors specifically? And I know the piece that we're working on today, it's kind of a thanks to you message. So if you had the opportunity to say thanks to you, what would that be?
Well, it would be thanks to you. We have a top-notch, gorgeous facility to provide high-quality care in, a place where patients can arrive and feel comfortable from the moment they set foot in the center, that they're being evaluated with the highest quality digital mammography units and top-of-the-line biopsy devices, and so the equipment is top-notch. We're pursuing additional equipment, different modalities that we don't currently offer for the evaluation and screening of women with for breast cancer. And down the road, you know, our eyes are definitely set on what is cutting edge now and what we think will be cutting edge in the future in terms of equipment for the diagnosis of breast cancer. So we're already looking at where we think we need to be for the next fiscal year, and what additional services that we think we may need to provide. We can't say anything except for thank you over and over again for the amount of selfless dollars and support that we have received for this project. The outpouring from the community was overwhelming, but that as we go forward, we're going to continue to do what we set out to do and make sure that we're staying, you know, right on the edge of what we need to do to compete and to provide the best service.
That runs my questions, Jan. Do you have anything?
Gosh, that last one was really where I was, thanks to your message. Is there anything else I know. Visions. Any vision? I mean, you talked a little bit about your vision for the future of the Comprehensive Breast Center. Is there anything that you would want donors or the public to know? I mean, you said you've got your eyes set on always being cutting edge, you know, leading innovative breast health services.
Yep.
Is there anything else you want to share? Is that pretty much taken care of?
You know, I think we have to be sensitive to the community that we live in, that we work in, and the community that we treat. And there has certainly been some work done, and some of this is work that we haven't really had to do, which we appreciate, from the local state government regarding how we're going to take care of patients who can't afford to be treated. One of the main messages that we started with and that we need to still echo to this community is we still know we're only capturing less than 50% of women who are true candidates for screening mammography. The message needs to be, let's rally the troops. The message needs to be, get the word out to your friends, to your family members. Get the word out to everyone who is of appropriate screening age and in the general populations that's 40 or greater, and let them know that there's no reason you cannot have a mammogram. We have a way. You can get breast health services provided right here. You can get them paid for through government programs or programs that have already been established right through Mercy Health. We'll find a way, but our main goal needs to be to make sure that screening is prevalent. So don't allow the fact that you think you can't afford a mammogram or that you may not have insurance to prevent you from getting health care and screening mammography, because we can get it done.
So really aligning with our mission to everyone regardless of their ability to pay.
Yeah.
And that's really getting the word out. I think that people think of that when they come to the ER, or they come in for an emergency, something, or they don't have a choice because they come to us without a choice. This is a choice. This is a conscious choice.
It is a choice.
Still aligning it with our mission to say, this may not be an emergency, but certainly we can help you make sure you have that.
And, you know, we know that in the instance where that screening mammogram may lead to the need for additional imaging and or a biopsy, there are funds to make sure that that is covered too. So it's not going to be a financial burden on you. The key is that you understand the importance of being screened and how important it is to catch an abnormality early. The non-invasive breast cancers have a 99% cure rate. If we can get our hands on them soon enough, we can take care of you.
It's so important, right? And anything we do is that early detection remains still the key.
Yeah, absolutely.
I have one last one.
Sure.
So without naming competitors, what is it that makes the breast program through Mercy Health and the Comprehensive Breast Center here different from what community members may be able to go elsewhere and receive?
Ooh, that's a tough one, but you know, I like to look at it from the perspective. I can't make a comparison to equipment, right? Because really, we all have the same equipment. So it's not about the equipment. It's not about the hardware. It's about who's using it. It's about how we're using it. It's about how we look at our patients. It's about realizing that human beings need to have a human level of understanding. And with our team that begins at the front desk through the technologists performing the exams, certainly with the addition of nurse navigation services, and if so need be, an evaluation by the high-risk coordinator. Everyone that's involved here, up to ultimately the radiologist reading the examination. We have specifically dedicated ourselves and our time towards providing that service. And trying to look at things from a whole patient approach and not just looking at it from a body part approach. It matters that we treat our patients, as they are, as people.
Can you briefly, really, and really, this is my last one, but when you said team of radiologists, we focus on this team, but you have a terrific team of radiologists that you work with too. I mean, and I know you have a pretty seamless transition with surgeons and, whatever, but can you just, do you have anything you'd like to share about your team of radiologists here?
Yeah, we have about 6 people, 6 or 7 that rotate in a dedicated fashion through the breast center. And, as part of our continued commitment to the Comprehensive Breast Center, we all participate in additional breast-specific educational activities on a regular basis. We all participate in our breast-specific conferences, and I try to hold a monthly breast education hour-long seminar that we all try to attend either in person or digitally by reviewing important cases. So, we've all made a commitment that although we do other things, that this is going to be something that we are spending more time and energy on. And I think, as the world changes and healthcare changes around us, and there are more demands on physicians to spread themselves thinner, I couldn't be happier than knowing that we have people who have truly dedicated themselves to breast services in particular. So I'm really, really pleased and thankful.
Got it?
I think you have?
I think I have it.
Okay. Okay. My pleasure.
Thanks to you.
Be painless. I'm relying more on this because you spoke so fast.
That's
so.
good. That's very good. No, we'll
Less
share.
notes.
We just have to. I like